Please welcome with me today two successful doctors, Dr. Usama and Dr. Mazen. You see a lot, patients come to your clinic. What do they mostly complain about?
There are some common conditions we encounter as gastroenterologists, such as reflux, which is we refer to as gastroesophageal reflux. Very common, people will refer to it as acid reflux and understand what that means. Other common conditions, as Dr. Mazen mentioned, is things like irritable bowel syndrome. Very common condition we see worldwide, and the UAE is no exception.
Is it diet? Is it lifestyle? What are some suggestions you would give as a doctor?
The first thing I say to them, please get out. Please exercise. Oh, it's hot, doctor. Every excuse you can hear. I finished late, doctor. There is no excuse. Once you get home, put your trainers on, get out for a brisk walk. I don't want you to run. I don't want you to do anything. Brisk walk, half an hour brisk walk before dinner even. This will make your brain give blood supply to your arms and legs and give little blood supply to your stomach. So when you come to eat, you're going to eat a little bit.
You guys will be in safe hands.
Expertise you can trust.
100%.
They're always looking for, doctor, give me this special medicine that my gut will feel better. But yes, we do use medications, but there's no one medication that works for all. Not yet.
We feel macho, all of us. We feel macho. This is normal for me. I have some loss of weight. I lost weight. This is not right. If you lost weight, this might be a problem.
Welcome to a new episode of GNTALKS featuring two doctors, Dr. Mazen and Dr. Usama, with us on the show today. We're excited to share significant news from Mediclinic Middle East. Both Mediclinic City Hospital and Mediclinic Parkview have been recognized as centers of excellence in endoscopy by the Surgical Review Corporation. Join us today as we discuss more details with both doctors. Good morning and welcome to a new episode on GNTALKS. Please welcome with me today two successful doctors, Dr. Usama and Dr. Mazen. Welcome.
Good morning.
Thank you. Good morning.
How are you both doing today?
Very well, thank you.
Very well. How are you?
I'm doing well, alhamdulillah. We're very excited to have both of you today with us on the show. But first, before we begin, it would be great if each of you guys could please introduce yourself to our audience. Let's start with Dr. Usama.
Thank you very much. It's a pleasure to be here today. My name is Dr. Osama Washo. I'm a consultant gastroenterologist and hepatologist. For those who are not familiar with, I'm a physician who specializes in digestive diseases and liver diseases. And I've been with Mediclinic for the last 7 years. And I'm very excited today to be with you today to talk about some new technologies in gastroenterology and some new patient-focused services we're excited to look into.
Amazing. Thank you so much. Dr. Mazen?
I'm a consultant physician and gastroenterologist with an intervention endoscopist lead. So what we do here is that similarly, we look after patients who are generally medical illnesses, in addition to any GI problems they have. In addition to that, we have the intervention endoscopy, which we do minimally invasive endoscopic procedures, which Mediclinic is one of the pioneers for it.
Amazing. So Dr. Mazen, before we start to talk about the gastrointestinal conditions that are very happening in the UAE, before we start to delve more into this, if you can give us like a short recap of what the condition is about before we go more into details.
Okay, well, gastroenterology involves the patient's illnesses from mouth to the bottom. Okay. So if we look after patients with reflux, we look after patients with ulcers, stomach diseases, inflammation of the stomach, inflammation of the small intestine, polyps in the small intestine, cancers of the small intestine, colonic polyps and colonic cancer. In addition to that, there is the irritable bowel syndrome, which, as you know, most patients have bloatedness and gases.
100%.
And there is definitely a link between the brain and the gut. So we look after all of this from top to bottom. So anybody used to say to you, I have a headache, they'll tell you, look after your tummy. Same thing.
Okay, amazing. We're going to get into more details on this, but I want to ask Dr. Usama, what are some of the conditions that you see a lot, that patients come to your clinic? What do they mostly complain about?
There are some common conditions we encounter as gastroenterologists, such as reflux, which is we refer to as gastroesophageal reflux. Very common, people will refer to it as acid reflux and understand what that means. Other common conditions, as Dr. Malin mentioned, is things like irritable bowel syndrome. Very common condition we see worldwide, and the UAE is no exception. These are some of the more simple conditions we look after, but they are more complex conditions related to inflammation in the bowel and the digestive system, called inflammatory bowel disease. Some listeners may have heard of Crohn's disease or ulcerative colitis, which are specific inflammatory bowel conditions. We obviously also look after people with digestive disease, cancers, and also not to forget the liver is part of the digestive system. So we look after a lot of people with liver-related problems. And one very common problem we see in the UAE and worldwide is fatty liver. It's becoming a lot more common.
Yeah. Why do you think the fatty liver is a reason for it, especially for people that are in the UAE? Why?
Very important question, because it's actually a mixture of things. It's the changes in our diet. We're eating foods that are high in refined carbohydrates, fatty food. Our diet has changed over the years. We're less active, more sedentary, and that leads to obesity, which is associated with fatty liver. So you get a lot more people in any population with fatty liver. And it's a very important condition because of how common it is. I mean, you're looking at 1 in 3 people out there have fatty liver. And it's a silent disease in the earlier stages. So it's really important to be aware of it. And it's a mixture of lifestyle and the development of obesity, which is considered what call a metabolic condition, which results in people developing it. And why it's important is because it can progress quietly to very severe liver disease and more long-term problems. So it's important to know about.
Amazing. Thank you for sharing. Dr. Mazen, I'm sure now the audience that's watching us now and listening to us now, the first question that's going to pop onto their mind is, what can I do to prevent all of this from happening? Is it diet? Is it lifestyle? What are some suggestions you would give as a doctor?
Well, all my patients, when they come in with these illnesses, the first thing I say to them, please get out. Please exercise. Oh, it's hot, doctor. Every excuse you can hear. I finished late, doctor. There is no excuse. Once you get home, put your trainers on, get out for a brisk walk. I don't want you to run. I don't want you to do anything. Brisk walk, half an hour brisk walk before dinner even. This will make your brain give blood supply to your arms and legs and give little blood supply to your stomach. So when you come to eat, you're going to eat a little bit. That's the first thing. Eat healthy food, 100%, just like Osama was saying earlier. The most important thing is the fatty food and the processed food that we're eating. This makes you gain a lot of fat and develop also illnesses like the fatty liver disease, like non-alcoholic fatty liver disease. And all of these, the best treatment for them is exercise and diet. And again, fruits, vegetables, we're really not eating so much of this. Before, the people used to eat all of these. Now, all ordering, pick up the phone and order, fast food, all of this is affecting our body really, and even affecting the bacteria, which we'll come to talk about later, because your bad bacteria increases in number now, and your good bacteria goes low in this, and you become bloated, lethargic, tired. All of this is affecting your life.
True. Dr. Mazen, let's say, for example, someone has a long day at work and they open a food application and they order, let's say, from one of the healthiest cuisines.
Yes.
Is this still considered because it's cooked outside the house? Is there any, some things that are into the food that could cause these things, even if though they claim they are healthy?
Well, there are healthy companies, yes, they do the healthy diet for you, but don't forget, there is also the cooking. You have to have grilled food, not fried food. All of this plays a part. And again, you can take the food. We're not against eating outside. Everybody has to have a social life. The most important thing also to alleviate your stress, because that affects your mood, affects your hormones, affects your digestion, affects your absorption. All of this plays a part. So we are happy for them to enjoy a day of outside, ordering outside, but also take the healthy food. You're allowed to have one meal a week, which is not healthy, but not every day a meal which is not healthy, because even our kids now They're on the
100%.
apps. They're using your app. I'm sure they're doing the same thing.
It's true.
All we get are messages. They've ordered. Get out. We encourage the kids to get out. This is much important than just sitting down and ordering food.
100%. Thank you. Dr. Usama, what are some of the common symptoms that patients come to your clinic and complain about?
Of course, as mentioned earlier, a very common symptom is bloating
Okay.
and gases, constipation, variation in bowel habits, abdominal pain, and the actual underlying root conditions behind this are many.
Okay.
So these are the common presentations we see. But somebody with bloating, if they're not assessed properly, may have actually a very serious underlying gastroenterological condition. Be it early cancer or even, inflammatory bowel problems. So it's important to understand that there's a lot of symptoms we deal with, but they can all lead back to quite serious conditions, or they may just be very mild, common symptoms people get in the community. We've all had problems with bloating once in a while.
Yeah, like water retention
and
is one
acid
of them.
reflux. Not so much. More like a feeling of the stomach being distended and feeling like you have too much gas in the system is a common symptom.
Okay.
Very common.
Correct. So now let's talk about something more serious. The endoscopy that is done. Lots of patients are scared to have an endoscopy. How do you prepare for the patients, Dr. Usama? I'll get back to you, Dr. Mazen. Yeah.
I think it starts from the time you decide to do an endoscopy for the patient. We have to allay the anxiety. It's all about communication. It's about the due process that we have in place to manage these patients, involving them with what's called sedation. These procedures are often done with the patient in a sedated state, so they don't feel this. Comfort is important. And in some patients, they even forget they've had the procedure because of the sedation, which is a positive thing because then the experience is better. But we follow them throughout the process, from the procedure, the post procedure instructions, the information. All of it goes a long way to keep the patient comfortable, calm, and to have a good experience, because that patient journey is very important for the patient,
100%.
especially if we find serious conditions that need attention.
Dr. Mazen, have you ever faced any challenge with any of your patients regarding endoscopy? Yeah.
Well, look, yes. These are misconceptions, as you've mentioned earlier, about the endoscopies. Patients come to me, I've heard this is painful. I've seen a video, they tell me this is torture. This is not true. They might have had a bad experience, and a person's not experienced in these procedures. In a Mediclinic, we are very experienced, and we're all internationally accredited. So it starts, as Osama said, from pre-preparation, in fact, from your clinic. So you explain to them, listen, this is a conscious sedation. You'll be conscious, but comfortable. We can top you up with the sedation, make you aware, not aware that much, but the patients come out of the procedure and say, have you finished? Yes, we have finished. Have you done this? Yes, we have. Because they forget the medication we give them causes short memory loss. So they're more comfortable like this. And after that, when they go to the ward, there are nurses there looking after them after recovery. And this is what the most important part is: pre, during, and after. How you look after your patient.
Amazing. I'm glad that you make your patients feel very relaxed and very soothed. And later throughout the show, we'll also be sharing with our audience where they can reach both of you doctors.
We play the music also.
Oh, you play the music?
Yes, we play music. It helps.
Okay, to keep them
to calm everybody. It's good for everyone. I think music is good for the soul.
100%. So basically, Mediclinic City Hospital and Mediclinic Parkview Hospital both are seen as centers of excellence in endoscopy. So why do you think so, Dr. Usama?
I mean, we're very privileged and proud to be now accredited by the Surgical Research Council Corporation based in the US as of this month, both Parkview Hospital and City Hospital. And this accreditation goes a long way because we've been accredited, and this indicates that we're reaching benchmarks of excellent clinical practice in endoscopy. And this is not just about the high technology endoscopy equipment we use. It's also about our processes, our protocols, how we look after patients, and it's about the patient's safety as well as good clinical and excellent clinical care. So it goes across the whole the whole spectrum. And why this accreditation? It indicates and it gives patients confidence that we are a center where we have highly experienced endoscopists, we have experienced multidisciplinary working teams, and we all work together for the benefit of the patient to give good clinical care in a very safe environment. So that's why it's really an honor to be accredited by the SRC.
Amazing. Thank you so much, Doctor, for sharing this with us. Dr. Dr. Mazen, sorry. Can you introduce the concept of gut microbiome? Correct me if I'm pronouncing it correct.
You're right. It's gut microbiome. Yeah.
Gut microbiome. And how does it affect the overall health?
Okay. I think we touched on this earlier. Your intestine, your GI tract, contains about trillions of good bacteria.
Okay.
Which helps you in your digestion, absorption, even your mood. Okay. And this also gives you the immunity. Yes. Because if you have bad bacteria, it affects your mood and it affects your immunity. So if your immunity not good, of course, your mood is not going to be good. So we have trillions of this good bacteria in our intestine. As we said earlier, if you're eating too much processed food, if you have multiple infections, if you've taken so many antibiotics, this brings your bad bacteria lower and lower.
Okay.
And the good bacteria comes lower and lower, and your bad bacteria becomes higher and higher. So these trillions of your good bacteria becomes less and less. So it affects your body system, affects you, lethargic I am, I can't go out, I'm tired, I'm dizzy, I'm foggy. I've got patients come to me, I've got fogginess. And that's part of the issue where we started also doing the gut microbiome and assessing for small intestinal bacterial overgrowth. All of this affects you and affects your GI tract. So if we correct this and personalize this to your need, everything changes.
Amazing. Thank you for sharing. Doctor, so you have been in the field for a very, very long time. Dr. Usama, being here for a very long time, I'm sure that there are a lot of young doctors that one day look at both of you and say, I want to become Dr. Usama, I want to become Dr. Mazen. What is one advice you would share with them live today? Being a doctor for such a long time, do you have any message that you would like to share with them?
Yeah, I think one important message is, as you go through your medical career, is to always remember to be patient-centered. You can slowly forget that the patient is center of everything you do, and always reminding them that everything you're doing is for the good of the patient. It is a career in service, and that service is about ensuring good quality of your personal care, making sure that you are up to date and that you're applying what we call evidence-based care to your patients, and you're respecting them as individuals. Because if you always remember that and you put yourself in the place of your patient, you're bound to become a good doctor.
Amazing.
This is a key thing. This is my important advice to any young doctors.
Amazing answer. Same with you, doctor, as well. We know that being a doctor is not an easy job. You get calls on daily basis, you don't sleep well, every single day there's something new happening. Correct. You have to be up to date. What are some, advice you would give to the doctors when things get challenging?
Yes. Well, my daughter just finished medical school and I gave her the advice which I'm going to give now. First of all, do the basics. Start from the below. You're going to crawl before you walk, before you run.
Amazing. Thank you for sharing. Dr. Usama, do you have any story that touched you on a personal level with one of your patients?
I think there are many. I don't think you can just pick one. There are many stories.
Okay,
at least one. I'm trying to think now. I need to think of a situation. I think it's almost on a weekly to monthly basis.
Okay.
And I'll say that there's a common stem to what makes you feel so good as a doctor. And maybe other doctors will tell you differently, but it's those patients who you struggled with, who have been so unwell, and you've managed to navigate their illness with them and get them to a point where they are feeling better. And when they walk into your office and they say thank you and they're so grateful to you for what you've done, sometimes that's the only reward you need as a physician, to actually feel job satisfaction. And I think that's the common stem of a lot of the experiences where I feel a lot of that my job becomes actually more than just a job. You know, it's a service to humankind, really.
You want to add something, doctor?
I was just thinking when you asked that question, Mediclinic, we try to, the doctors are internationally accredited, they're very good. That's why they try to bring the best doctors to the best hospitals. But also, there's the devices also will help us. For instance, when we started in Parkview, Osama was with us. He remembers very well that we got the AI, the artificial intelligence, which is fantastic.
Okay.
In addition to that, we got something called Spyglass, which is a scope which goes inside the bile ducts. And this was a very expensive scope. This is the first time it enters the Middle East even. So we got it into Parkview Hospital at the time.
Okay.
And the first patients we did, the patient had yellowness in his eyes and body and jaundice. And they couldn't find the cause. The MRI couldn't find anything. The CT scan, only the blood tests were deranged. We can't find the cause. So we did this spyglass, and there was a 2 millimeter cancer, 2 millimeter, that needed the patient to have a major surgery and saved his life. Till now, every year on the date, he sends me a card. See, this is what we mean about surgery. This is really heart-fluttering.
Okay. Dr. Mazen, how do you feel like, AI technology has impacted medicine these days?
100% AI. Look, when we started the process of the AI, we wanted to bring it, we wanted to be unique for patients' care also. So, for instance, we started with the colonoscopies, we brought the AI for it. The guidelines for the world used to be, if you pick up polyps, every doctor has to pick up polyps by 25% of their procedures has to pick up polyps in these procedures. Now, we wrote the first data from the UAE on the AI in Mediclinic, and we've increased that to 35% from 25%. So we're saving more lives. We're picking up more polyps. Polyps can change to nasty things in the future. And now we have the AI for the capsule endoscopy. So now we've got it also for the small capsules, which it shortened my time period for reading the report over 3 to 4 hours to 20 minutes.
Wow.
So huge difference. We're saving lives and our time management became different.
100%.
It's making its way definitely into gastroenterology.
100%.
Yeah. Dr. Osama, as Dr. Mazen has said, it has really positively impacted, made things so much more easier. Where would you see medicine, especially in your scope of field, with AI in the next few years? So it will take 20 minutes. Do you think it will take a couple of seconds in the future? Or do you think that this is something too hard to believe now?
I think AI is very much, currently, you can see it, it's got its place in detection, in assisting us to see lesions and to see, as Dr. Mazen mentioned, early cancers that we may have missed potentially, and also to help us with decision making. And I think it's going to certainly affect the new doctors and the training doctors, because they're going to have to learn more how to integrate this. Because if you've learned medicine and you've trained in medicine in the conventional way without AI, you as the newer doctors, it'll be so integrated into their decision making, how they manage patients, possibly even what treatments they would consider. And in a way, I think it will be beneficial, but also we always have to remember, I think every profession now is trying to claim themselves that we don't need AI and we should be independent. I think medicine will always have the human factor. I don't think we're going to be in a situation where you'll be sitting here and you're talking to a computer.
A robot.
In a robot instead of a human being, because there's a lot of other human factors that go into medicine, and I think that's where AI has to catch up, I think, in my view.
I'll add one more thing to this. For instance, the new AI for picking up those polyps, it started telling us how much of this polyp is cancerous, how much of this polyp is benign. This will direct us for future management. For instance, in Mediclinic, we do endoscopic surgical dissection, which there is no more resecting certain cancers of the colon surgically. We do it endoscopically. So this type of AI is going to tell me I should do this one rather than refer the patient to the surgeons. Of course, the patient doesn't want to have surgery. They'd rather have an endoscopic procedure.
100%.
So we do this in Mediclinic.
So I think today, from the GNTALKS, we can relax everyone and tell them, please come to Mediclinic. You guys will be in safe hands.
Expertise you can trust.
100%.
Evidence-based practice.
100%. Dr. Osama, how can patients reach out to you?
They can contact us through the Mediclinic call system. We're all available, even through the Mediclinic app. This is a good way to contact and to see the huge array of doctors we have available, all experienced, particularly in the field of gastroenterology. And I just wanted to also plug in, which is really important about AI, is about the microbiome wellness program.
Yes.
Because this is personalized medicine. This is where things are going. And this is a very interesting area, because we didn't mention about the microbiome test, because the way it works is actually you use genetic sequences for your whole gut microbiome.
Wow.
And you get this huge array of results. But all those results get analyzed by AI.
Wow.
An AI-powered machine learning tool to give you information that's personalized to you, how you should adjust your diet to maintain your gut microbiome wellness, if there's any poorness, if there's any issues around the diversity of your gut microbiome, you can look into ways to improve that through diet therapy, seeing a dietitian, seeing a gastroenterologist. So it's all very much about personalized care. So we want to really encourage people to consider, this is the way things are going, because this is what AI is going to do to gastroenterology and medicine as a whole. It's going to get us to a point where we can personalize what we do for each patient.
And in fact,
100%.
Mediclinic has started making packages for this.
Yes, I was just about to ask you. You just read my mind, and with no AI technology.
See, we started reading your mind now.
Absolutely,
100%.
Can you elaborate more on these packages?
Well, we started this because we were one of the things Mediclinic was pushing for this, because lots of patients were saying, this is what's happening in the world. We're saying this, okay, this is, we've got it for you. So we have the stool test, which is a simple test, goes to the DNA testing, and the AI picks it up, and all this recorded. Okay, what's after? Okay. This is what we need. Then you have a dietitian consultation. You have a personalized package for your probiotics, whatever you need. And according to this, and then you'll be monitored. You're going to be reviewed later on. How do you feel? What's happening with you? Oh, I'm 50% better. I'm 40%. So that's how we're going to monitor this.
Amazing. Thank you for reading my mind and for sharing this, Dr. Mazen. I want to ask Dr. Usama, how can patients manage GI symptoms by themselves at home? You did mention, Dr. Mazen, like through diet and healthy lifestyle, but let's say, is there any other way that they can manage these symptoms? I don't know, maybe like some sort of a remedy you could share with us?
I think that's a golden question. Everybody's looking for that what they call golden bullet medication or supplement or herbal remedy that's going to make their gut function well. Unfortunately, it's not just one thing. As Dr. Mazen said, it's about good components of your diet, what you're having, whether you're having lots of fiber in your diet, and it's all linked to what is good for your digestive system and your gut microbiome, and how you balance it by what you eat. And it's also aspects outside of your diet. As Dr. Mazen mentioned, movement is medicine. Exercise and less sedentary lifestyle is important for your gut. Lack of stress, improvement in your stress and how you manage stress, also important. And your sleep. So it's a very holistic thing. If you want to have a good gut health, you have to focus on everything. All aspects. Unfortunately, there's no magic medication, although every time patients come into clinic, they're always looking for, doctor, give me this special medicine that my gut will feel better. But yes, we do use medications, but there's no one medication that works for all. Not yet, at least.
So at least for the women that are watching us, go walk at the mall. Yani indoor.
Walking is healthy. No, brisk walking is your exercise.
Okay.
Walking is for your health. Yes, for your. Yes, but you have to do brisk walk. 30 minutes of brisk walk or a light jog. That's what I want from you every evening before dinner. You will see your life changes. Trust me.
Dr. Mazen, I want to ask you, are more of your patients women or men when it comes to this specific condition?
Women. Because women are very clever. They go to the doctor very quickly. Men, we feel macho, all of us. We feel macho. This is normal for me. I have some loss of weight. I lost weight. This is not right. If you lost weight, there might be a problem. I have some gas, it's gone when I lost the weight. You need to see a doctor. You can't be your doctor yourself. So women straight away to the doctor. Men delay things. That's why sometimes we pick up things and men late. While women straight away, we deal with them.
Wow, impressive. Women, encourage your men to
Clever.
go visit the
Clever.
doctors. Today we have Dr. Mazen and Dr. Usama with us today on set. Is there any specific message any of you doctors would like to highlight before the end of the show? Is there any message that we didn't tackle, we didn't speak about, that you would like to highlight individually?
I think I think we've covered a lot today. We've covered a lot of aspects, and I think the important thing is just to, to understand that as a specialty, gastroenterology is a lot of patients with this have these common conditions, and it's important to understand when your symptoms may not be simple gas or bloating or whatever it might be, and realize that you should try to come and see a gastroenterologist, because the key thing is about early detection of problems so that you can deal with them early. And I think we are all attuned to that now. We're all very aware of this. And the last message is about wellness. The gut microbiome wellness program, the key word is wellness. We're trying to keep ourselves healthy, before we get the pre-disease state. So it's about focusing and understanding that you can use such tools to get you to a position where you can enhance your wellness, enhance your well-being, to prevent disease in the future. So that's my concluding.
Where can they find you, doctor?
Well, I'm based at Mediclinic City Hospital and Mediclinic Dubai Mall.
So they can find you there?
Yes, yeah. And, we're found on the Mediclinic app as well. You'll find a whole array of experts in their field, including in gastroenterology. And we have a network of like 7 hospitals and many clinics in the UAE. So you can find me personally there and many other expert gastroenterologists.
Amazing. Thank you. Dr. Mazen, we'd like to hear the message from you.
I think the message should be combined for everything. First of all, Mediclinic is a good group they get the best doctors for the patient's sake. That's one. That's why they've got their motto of expertise you can trust. That's one. Secondly, the doctors themselves, they love, for instance, if they work there so that they can push the boundaries, they can ask for things to be available for them. Like I did. I wanted 1, 2, 3. I want the AI. I want this. We push for it and we try to get it for what? Not only for us, because we know we want to help the patient. That's the second thing. Thirdly, we are a subspecialized group now, because we specialize and now subspecialize, and we're doing endoscopic surgical dissection, we check cancers endoscopically, we're doing sleeves endoscopically.
Okay, where can we find you, Dr. Mazen?
I work basically in Mediclinic Parkview Hospital and Mediclinic Dubai Hills Mall. We have a clinic there, and similarly you can contact our contact center.
Okay, perfect. It was a pleasure to have both of you doctors with me today on the show. And
pleasure is ours.
Thank you. Thank you for sharing very insightful information about each of your expertise and also about Mediclinic itself.
Thank you for having us.
Thank you for having us.
Of course, my pleasure. So this is the end of today's episode. Stay tuned to another well-established business in the UAE and globally. Have a good day.